Assalamu alaikum. Get first aid at home. On behalf of the healthcare home, I am Dr. Mohammed Prince Sheikh. Today's topic: how to treat muscle cramps at home. What are cramps in the muscles? A muscle cramp is an abrupt, uncontrollably occurring contraction or spasm in one or more muscles. The majority of healthy individuals who have muscular cramps or pain are middle-aged and older, while younger people can also experience them sometimes. Though they can also happen when you're relaxing, cramps typically happen during or after intense physical activity. Gentle leg cramps that usually happen at night and have no apparent cause. They can last anywhere from a few seconds to many minutes and are rather unpleasant. The foot and toes curl downward when leg cramps associated with sleep mostly impact the calf and foot muscles. These cramps are known as benign leg cramps because, despite their discomfort, they are typically not life-threatening. You can have cramps in any muscle, but they most often occur in back of leg calf, back of thigh hamstring, front of the thigh quadriceps. Cramps in the feet, hands, arms, abdomen, and along the rib cage are also very common. Muscle cramps can occur while you are playing tennis or golf, bowling, swimming, or doing any other exercise. Almost everyone experiences muscle cramps sometimes, but some medical conditions increase the risk and/or severity of these cramps. These include thefallowing. A tight calf muscle is caused by a lack of stretching, lack of exercise, or sometimes a repeated buildup of fluid, a medical condition called edema in the lower leg. Tense or overuse of a muscle. This is the most common cause. Playing tennis, golf, bowling, swimming, or other sports might cause muscle cramps. A disease of the nerves, nerve compression, from problems such as a spinal cord injury or a pinched nerve in the neck or back. Dehydration. Low levels of electrolytes such as magnesium, potassium, or calcium. Muscles with poor blood supply. They can also be caused by alcoholism, hypothyroidism, underactive thyroid, renal insufficiency, medicines, menstruation, pregnancy, undergo dialysis. Sometimes the cause of muscle cramps is not known. Conditions that cause or promote muscle spasms: dystonia, tetany, illusory muscle spasms. Peripheral artery disease in the legs, commonly referred to as peripheral artery disease, can occur during physical activity, such as calf pain, intermittent claudication, when walking. This pain occurs due to insufficient blood flow to the muscle and not, as with cramps, due to muscle contraction. Who is at risk for muscle cramps? Anyone can suffer from muscle cramps, but they are more common in older adults, overweight people, athletes, pregnant women, people with certain medical conditions, such as thyroid and nerve diseases. When is it necessary to see a health professional for muscle cramps? In general, muscle cramps are harmless and disappear after a few minutes, but you should contact your healthcare professional if cramps. They are severe. They occur often. They do not improve with stretching and drinking enough fluids. They last a long time. They are accompanied by swelling, redness, or a feeling of heat. They are accompanied by muscle weakness. What are the treatments for muscle cramps? You usually don't need treatment for muscle cramps. You may be able to find relief from cramps by 1. Stretching. Stretching helps prevent cramps because it prevents involuntary and intended muscle contraction. For example, if you have a leg cramp, the affected person can pull the foot and toes up with their hand or do a runner's stretch. Stretching exercises make muscles and tendons more flexible and less likely to contract involuntarily. Stretching the gastrocnemius muscle, as runners do, is the best antidote for preventing leg cramps. To do this, place one leg forward and bend it at the knee. The other leg stands behind, with the knee extended, creating a lunge. To maintain balance, you can place your hands on the wall. Both heels remain on the floor. The knee of the front leg is further bent until a stretch is felt along the back of the other leg. The greater the distance between the two legs and the more angled the front leg, the greater the stretch. The stretch is maintained for 30 seconds and repeated 4 to 5 times. Then the stretching exercise is repeated on the other side. 2. Light massage. Applying pressure to the affected area with your hands or a massage roller may help you feel better. Apply heat when the muscle is tight and ice when the muscle hurts. 3. Drink more fluids if you are dehydrated. The most common cause of muscle cramps during sports activity is not drinking enough fluids. Drinking water will often provide relief. However, water alone does not always help. Effervescent salts or sports drinks, which also replenish lost minerals, may be helpful. Drink plenty of fluids after training, especially potassium-rich drinks for athletes. Muscle cramps that occur due to exercise cramps during or immediately after exercise. 4. Mineral balance. Increase your potassium intake. Hypokalemia, or low potassium, can impair the proper function of your muscles. Increasing your potassium intake may be a natural way to relieve muscle cramping. Squash, potatoes, spinach, lentils or beans, bananas, and cantaloupe are a few foods high in potassium. Taking more magnesium. Dietary sources of magnesium include nuts, legumes and beans, cereal grains, and leafy green vegetables. Eat more calcium. Calcium is necessary for the proper operation of muscles. Increased calcium consumption may lessen the severity of your muscle cramps. The presence of vitamin D is necessary for the correct absorption of calcium. The sun and certain foods, such as salmon and egg yolks, are good sources of vitamin D. Milk, soy milk, some fruit juices that have been fortified, and dark leafy vegetables like kale, broccoli, and spinach are dietary sources of calcium. Most pharmacies also carry calcium supplements, although some research indicates that there may be more health risks than benefits, including kidney stones and other issues. See your doctor before taking this or any other supplement. 5. B-complex vitamin. Some people discover that managing their leg cramps is made easier by taking vitamin B complex and other vitamins. 6. Refrain from exerting too much energy. You can prevent muscle cramps by gradually increasing the duration and intensity of your exercise program without going overboard. If the cause of your cramps is another health problem, treating the specific problem will likely help. There are medications that providers sometimes prescribe to prevent cramps, but they are not always effective and can cause side effects. Talk to your provider about the risks and benefits of these medications. 7. Avoid caffeine because it can exacerbate muscle cramps. 8. Medications. Most of the medications or supplements prescribed to prevent recurrent cramps, such as calcium supplements, magnesium carbonate, and benzodiazepines such as diazepam, and over-the-counter drugs like acetaminophen. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen. How can you prevent muscle cramps? Preventing cramps is the best treatment. The following measures can help. No exercise immediately after eating. Stretch your muscles, especially before exercising. If you have leg cramps at night, stretch your leg muscles before going to bed. Drink plenty of fluids after training, especially potassium-rich drinks for athletes. Avoid caffeine, for example in coffee or chocolate. Do not smoke. Avoiding stimulants such as caffeine, nicotine, ephedrine, or pseudoephedrine, a decongestant contained in many preparations that do not require a prescription but are only available in pharmacies. When to see a doctor. If muscle cramps are severe, frequent, or interfere with daily life. If cramps are accompanied by swelling, redness, or weakness. If you have underlying health conditions that may contribute to cramps. Remember, if you experience persistent or severe muscle cramps, it's essential to consult a healthcare provider for proper evaluation and personalized advice. Follow the page for regular health messages and tips. Thank you.